Hi, everyone, and welcome back to Mic Check
2.
My name is Rachel.
I'm Sean.
And today we have a special guest. Very hard to find and get him here, but we are so honored.
It took 2 years.
Such an honor to have you. I will allow you to introduce yourself to the people.
Good afternoon. Good morning. Early morning. 7:30 in the morning. James Sims here, Chief Medical Officer, St. Hope Foundation, Healthcare. Been here for 11 years. 12 years.
When did you start? What year?
2011. No, 2012.
2012. Oh, so you just made 12 years then? Mm-hmm. Wow, you've seen it all then.
Yes, the evolution
of St. Hope.
As the world turns.
Well, we love that. So you are the Chief Medical Officer here. So you kind of oversee all of the medical things happening at St. Hope.
Yes. So the purpose of my job is to ensure that the medical side is geared towards evidence-based medicine practices, making sure that the operations go well in terms of the guidelines, guiding the providers, making sure they do well and follow the guidelines in terms of delivering medical care.
Nice.
He does it all.
And then we have a really interesting topic today that I feel like often gets overlooked. We never really talk about men's health, like overall care. So we thought you would be... Well, we're starting to break the trend. We thought it would be great to get you here.
Finally got us aboard. Huh?
Yes. So we'll go ahead and just dive into it.
So, with Dr. Sims being here, and we're talking about men's health, we're going to talk about the good, the bad, and the ugly. But we're going to start with the easy questions first.
Okay.
And we're going to get into the juicy stuff later. Or maybe not so juicy. But we're going to start with, what routine screenings do men typically need and at what ages?
Oh, very good question. So, heart disease is one of the leading causes of issues within men. It's like 1 in 4 men are diagnosed with heart disease or die from heart disease, or succumb to some kind of physical ailment related to heart disease. So health screenings are always around those issues around heart disease. Like high blood pressure, you should start screening yourself for high blood pressure around the age of 18, and then every 2 to 4 years thereafter if you don't have hypertension. Diabetes starts around your 35. You should start screening for diabetes around the age of 35. Mm-hmm. Then from there, it's every 3 years. What else? Cholesterol, high cholesterol, which is another issue with cardiovascular disease. Should start screening around 35 years of age. From there, sexual activity, STDs, start screening around the age of 18, 3 years or up to 40. Per the guidelines, but many older men are sexually active, so it extends up until they're no longer sexually active. So HIV screening, hepatitis C screening, STD, gonorrhea, chlamydia screenings, depends on your sexual activity, should be started around the age of 18. What else? Prostate screening. That should be started around the age of 45, depends on your health risks, if you're African American man. And then, if you're a normal population without any issues, well, I guess we'll dive a little more into prostate screening, but, at least at 45 and then go from there up to the age of 70. Colon cancer screening, that starts at the age of 45 and extends up to like in the 70s.
So I'm going to try. I got a lot of stuff.
Yeah, you need a checklist for that.
Yes, you need a checklist.
Now, you listed a lot of stuff. In your years of this profession, what do you think is probably the most or the biggest health issue out of everything you've listed that can go overlooked?
I think the biggest health issues are just, I guess, like I said, heart disease. Heart disease affects men, and 1 in 4 men are affected by heart disease. High blood pressure, because our dietary habits, our lack of exercise, all contributes. Smoking, all like the things that men like to do, it contributes to heart disease. We eat the 16-ounce steak and we smoke and we don't exercise, and those over time contributes to heart disease. So I think like I said, that's one of the bigger issues that affect men this day and age, and that's what we succumb to most times.
Is that like a heart disease kind of testing related to like stress tests? Could that affect anything?
Well, stress testing is a part of the workup for heart disease. Mm-hmm. You should start with your EKG. Again, there are signs that's why it's important to go to the doctor on a regular basis, because you pick up things easily. The elevated cholesterol, the elevated blood pressure. Those are signs and symptoms of, signs of heart disease. Something's going on. So those are how you start to look for and dive into it. Blood sugar is going elevated. Those contribute to cardiovascular disease. So there are things that happen along the way that kind of points you in the direction that you're developing heart disease. And then once you have those signs and symptoms, you do diagnostic testing for the stress test, the EKGs, to determine how severe you have heart disease.
Now, I don't know about everybody else. I know for me, I hate going to the doctor. I hate it. But
why is that?
I just don't like going to the doctor. And I'm sure I'm not alone. There's probably a lot of guys I'm sure you see that frown upon coming to the doctor. You may recommend someone to come, once every how many months? And they may show up half of that?
Yeah, that's true.
Why do you think that is? Is it like a hyper masculine thing? Or do you think just guys in general don't typically care to open up to a doctor?
I think that men in general are very reactive. So they're not proactive. They're very reactive. So if they have signs and symptoms of things, they kind of downplay it. So we downplay a lot of our issues until they get really horrible. Then we run to the doctor and looking for assistance with that. We're very stoic individuals. So we don't like to be seen, it depends more on the fetus type of attitude when we go to the doctor. Like we are laying our guard down, we losing control of our bodies and our health. So we don't recognize that. Sometimes it's a fear factor. Sometimes men just fear bad news and they don't want to hear it. Sometimes it's what are the issues? The distrust. For medical care, sometimes there's a relationship issue. They distrust medical care. That's another issue. Sometimes just bad experiences overall, in terms of mental health. Sometimes men don't want to, a lot of the individuals are female in mental health in terms of the providers. So sometimes it's, being vulnerable and open yourself up and don't want to mislabeled or seem weak. Talking about your mental health issues, talking about how depressed you are, So it's multifactorial why people don't go to the physician, why men don't go to the physician. But I think most times it's just the simple fact that we just are very stoic and we just don't want to.
If it ain't broke, don't fix it.
I feel like you're saying stoic, but it should be stubborn.
Stubborn?
It's stubborn. I like the word stubborn. Let's say stubborn. A little stubborn.
Stubborn because the woman told him to go to the doctor?
Yeah.
Okay.
And you sound like my dad is very like that. He's like, it's only something wrong when I go to the doctor. Like, well, you waited until the last minute, so of course you're going to get bad news.
But that's the fear
of
not knowing, the fear of saying something's going to bad happen to you when you go to the physician. So you don't want to get into bad news,
Do you think the media kind of plays into that for men?
No, I think it does not. I think that, you hear a lot of good things in the media, that's why people come for the doctor for the blue pill, the purple pills. And, because
what's the blue pill?
The blue pill is the Viagra. So,
they coming for that. They coming for that.
The Cialis, or you're in the bathtub with the Cialis and the ladies bringing you wine and things like that.
Right.
So things like that, so that people are watching observing media because they come in asking for certain pills by colors and that what I saw on the TV or what I heard. So media does play a role. I think we spend about 12 hours so we getting information from the media, news sources, radio, social media. So it's very involved with our lives. We may not pay attention to it, but it's there in the background. The news is playing in the background while we're doing our work. You have the radio on. Every now and then someone's talking about advertisement and things. So it's like subliminal messages given to you all the time with regards to media and about your health.
I think it's interesting. They're coming in for certain stuff, but not like my heart.
I need a prostate exam.
Yeah, like I need. They're not like I need a stress test. They're like, where's that blue pill at, doc?
Right. Yeah, people don't like invasive procedures either. They don't want to be poked and prodded. That's why men don't want to do colonoscopies or digital rectal exams or prostate cancer screenings because it's a vulnerability and they don't want to have those invasive procedures done on them.
That makes sense. I want to get into my big question is just the stigma around men coming into the doctor, especially for like STD checking. I know you kind of mentioned that's one of the tests you should be testing for around 18 in your sexual active time frame. But a lot of times, especially with men, I've noticed they're always like, oh, if my partner got tested, I'm good. But the partner got tested 2-3 years ago. They got 3 new partners since then. And they still haven't made that appointment to see the doctor. Why do you think I asked both of y'all, why do y'all think men just are so trusting of their partners?
I think it's vice versa, you know. I think it's a little both.
That's a case by case kind of thing.
Well, that's true, but
like if you're going around town doing your thing, that's one thing. But if you're with somebody, it's kind of like, for me at least, it's like a comfort level. Like, okay, this is my person. This is my person. I possibly wouldn't have to feel as obligated to.
But are you getting tested in the beginning of the relationship?
You know, you'll get tested in the beginning, and then at least like once every 3 months.
Every 3 months or so, you should get
Roughly
tested.
so.
Yeah.
But as time goes on, let's say me and you are in a relationship and we're together for 10 years. We're in like the 8th or 9th year. It's like, oh, okay, well.
I think you should get tested all times. I think that initially you should. I think it's important. You know, it's your responsibility. You're responsible to your partner that you're in good health.
Right.
And I think that testing for STDs is one of the things that you should do because you don't want to give your partner anything. I think that we just had a recent conversation at a meeting about, you know, testing and, you know, making sure like women in PrEP, you know, women are not on PrEP because they assume that, well, my partner is safe and, you know, we're in this monogamous relationship, so I don't need PrEP. I don't need to take the responsibility or taking medication to prevent me from getting HIV. You know, some individuals don't even have the conversation. Are you HIV positive? When the last time you've been tested? You know, you say, oh, he looks good. We're good. You know, so we don't need to get tested. We don't discuss it. So I think that's, you know, you're empowering your partner. You're giving power to your partner with regards to your health. You're giving to say that, okay, well, I'm giving this, I'm ensuring that I'm putting my health in your hands, you know, and I think that's a lot of times, you know, it has been backfired on individuals who, you know, gave power to their partner and not protected themselves because people are sexually active. And I think that sometimes it's good, you know, in terms of monogamous relationships, but sometimes people go off and come back in and, you know, then they bring things home. And then men have symptoms when they have STDs. Sometimes women don't have symptoms.
Men have symptoms for every STD?
Most, yeah.
He got to think his limit.
Yeah, syphilis, gonorrhea. You have some kind of discharge or some kind of burning with urination. Men have symptoms. Yeah, trickle. You know,
I did. Okay, because I know women can be asymptomatic, but I thought men could be too. No, well, they can.
In most cases, I can't say all in medicine, but you know, most cases they have some symptoms when they present with STDs. You know, that's what brings them to the doctor here. We're being reactive again. Not proactive, but reactive because I'm having symptoms. I'm coming to the doctor for symptoms. So there we have it.
And then you're not getting checked. They're probably taking their medicine. So ladies out there, make sure you're getting your testing as well.
Get your testing. Take your prophylaxis. Right.
You have to.
PrEP. You take your PrEP.
And then I did want to backdoor because it's not about like the 9-year relationships. Because, you know, 9 years, hopefully in that time you do have like an understanding, like a routine, you know, in our perfect Disney fairy tale lives.
When our white picket fence.
But you still should get tested. Women go get their pap smears done every 1 to 3 years, depends on their, you know, what's going on there. And doing their pap smears, they get tested for STDs.
That's true.
Right?
Oh, that's
so
true.
men don't get tested like that.
They don't.
Now, when men do the physical, what all do we look for? Or what all do you look for, like if a man came in for like his annual physical?
So when you come in for a physical, you should get examined from head to toe. Check your heart, check your lungs, check your blood pressure, you know, what else? You know, testicular examination, if you fall in that age range, that should be done for you. So if you're in the age range of prostate examination, you should get a prostate digital rectal examination done. So all those things should be done during your physical. And then in addition to that, you get your blood work done, your cholesterol, your hemoglobin A1C, your chemistry panel, look at your kidney, your liver functions. What else? So yeah, all those good things. If you're a certain age, you get your thyroid checked, you know. So
now, I've actually had somebody come in recently that was shy about getting a testicular exam. And they asked me at the front, they were like, well, why do they have to do this? Could you actually explain, like, what's the point of doing a testicular exam?
Certain ages, you know, you're at risk for developing testicular cancer. So it should be done. You know, sometimes men should do, you know, testicular examinations. Take your first and second finger and roll your testes around in your between your fingers. It should be nice and smooth with no lumps or bumps. On the top of your testicles is a little squishy area, epididymis, that should be squishy but nothing inside the epididymis. Sometimes you have lumps and bumps in your testicles, it's a sign of testicular cancer. Sometimes if you have little squishiness in little bumps in your epididymis, it's a sign that you may have a past infection within your epididymis. So there's reasons to do that. And be in tune with your body. I think that's the importance of it.
So I was going to say, like, when men do come in for the appointments, like you see how he asked Sean at the front desk, do you have like more men that may come into the appointments and they'd be like, oh, no questions, doc? Like they're just ready to get up out of there.
Sometimes, yeah, they just come in and say, I'm here for annual physical. So I think at that time, the body just kind of starts asking questions, see what's going on, ask about health risks. What do you do? Do you jump out the planes all the time? Do you do these extreme activities? What brings you in? Some people say, well, my father and brother had prostate cancer, so it's time for me to get prostate cancer. I heard something on TV, so or have colon cancer. The young actor died of colon cancer.
So what's one main question if somebody comes in, even if they can't think of nothing, that they should probably be asking their doctor?
It just depends on the age. I think that.
Like I'm coming in 18. It's my first. I'm getting everything done. I'm getting my STD checks. I'm getting my
So I guess the
levels.
thing that you should ask, what can you do to improve your lifestyle? What can you improve to, make sure you're living the best life? That's one thing you should do. And that the doctor would say, well, you need to eat healthier. Watch what you eat. I think that a lot of times we overlook certain things or dietary habits and exercising. And that's one of the things you say, how can I improve my health at this point in my life? So that's a good question. What can I do to improve my health at this age that I have going forward? And I think that will open up all doors in terms of your eating habits, your exercising. They'll do a full evaluation of your lab work and things like that. But I think that's the key questions. What can I do to improve my health at this age?
That's a good question.
And now when it comes to exercise, I know that's everybody's kind of like, myself included. And I know you had mentioned stress test can indicate any kind of like heart issues or anything. Do you recommend for people or for men in general, if let's say they're starting to go back working out, do you think they should get a stress test prior to, or do you think they should just kind of ease into exercise?
Well, it depends on the age, though. If you're 18 years of age.
What about like 30s and 40s?
He's asking for himself. He's trying to get an appointment without making.
No, not necessarily. I think it depends on your physicality. I mean, what you've been doing with your life and what's going on. I think that stress test is only doing, again, you may get an EKG if you're like in your 40s or your 50s and you want to start exercising, that's part of your physical. But actually doing the stress test is not necessary. I think you just ease back into it. You get your general checkup, and then you start doing your, walking. When people say exercise, it's not meaning going to the gym and lifting weights and doing
3 miles on the treadmill,
doing burpees and doing jumping on the box bench and jumping down, and simple things. Studies have shown that if you need to do 10,000 steps a day, just walking, get on the treadmill, set your incline up, and just walk. That's a good way to give good cardiovascular activities on your heart. Without running, you don't have to run. It's not running is not necessary. Just walking and inclining, walking on the incline. If you want to do that, get you 3 miles a day. 3 miles is 10,000 steps, by the way. And also, doing body weight activities. Trying to do sit-ups, trying to do, you could do push-ups, just body weight activities. You don't have to necessarily lift weights to, get back in the habit. And as you go on, you just build up over time with that.
And I do have a question before we get into the juicy stuff. We mentioned like heart disease and like heart issues being like the number one complication. What are like some early signs like that men should be looking out for?
Again, like monitor your blood pressure. It's one of the signs that you may see. A lot of people walk around with elevated blood pressures. They don't know.
So I guess this is more like, I know we kind of hit it on the blood pressure stuff, but this is more around like if they've never even seen a doctor. Like what are signs? Like if their feet are swelling or something, Sometimes people come in with headaches, unusual headaches.
sometimes people come with chest pains, which are late signs for heart disease.
You're like, that's a little late.
Come on in, we'll see you.
Yeah.
What else? I think sometimes people may see vision issues, and maybe if they go to the eye doctor, they may see changes in the background of their eyes and stuff. They're like, hey, you have high blood pressure because your eyes are a little abnormal here, so you may need to go to the doctor. So it's not warning signs. You get warning signs for heart disease. It's almost you're in the late stages.
Okay.
That's why it's preventative to go to the doctor and check things. When you go to the drugstore, stick your arm in the blood pressure machine.
Oh yeah,
and check your blood pressure.
Yeah,
check your blood pressure every now and then.
Yeah.
Simple things like that. If you find that you're exercising and you just can't catch your breath, your heart rate can't go down back to normal within a few minutes. Those are bad signs. You say something's going on. I can't get back to normal after I walked around the block. My heart is still like 200. I just went around the block.
I didn't even do nothing.
I didn't do anything. So it's common sense tells you things.
Okay, that makes sense.
Yeah.
Don't skip over them headaches because a lot of men would just be like, oh.
Yeah, stress contributes to heart disease. Type A personality, stress. That's also, it makes your blood pressure go up. It contributes to your heart. It's another factor related to developing heart disease. Stress, cholesterol, high blood pressure. Not able to maintain your anxiety levels. Those all contribute to your physicality.
And speaking of, when you're doing these exams, what about if someone's urinating frequently? Is that like a bad sign?
Depends on the age, depends on, you ask questions. So what are you drinking? When are you drinking alcohol before you go to bed, or you're urinating a lot? Sometimes men do have urinary tract infections. So that may be a part of it. Sometimes, men have prostate issues. That may cause overactive bladders.
No, wait a minute. You said men can get UTIs.
I was like, you're going to skip right over that. I did not know that.
So ladies aren't the only ones that get you, because usually if a man gets a UTI, it's a burning or
there's a burning sensation.
And they may just immediately think, I got an STD.
Right. This would be just urinary tract infection, especially in the older men. Sometimes you get urinary tract infections and things like that. So it's possible, yeah.
Oh, that's so interesting. I really thought I didn't think it was only for women, but you just never really hear it.
Rare.
Yeah.
It's not, I won't say rare, but it's less likely than a woman. But men do get urinary tract infections, yes.
I'll speak for the women. We still got it hard. I know y'all going through some things. You got a whole checklist from 18 to 73, but women got it hard too.
Yes.
Y'all have a few things.
Check. It's always something. So let's go ahead and get into the juicy stuff.
I know people are wondering, they're like, when is he going to talk? Because he already brought up the blue and the purple?
The blue, the yellow pill, and the red pills now.
Oh.
Depends if you're for the internet, right?
So now when patients come in and they talk to you, and I'm pretty sure you get this a lot, men come in and say, Doc, basically I'm having a hard time getting it going.
What does it mean?
Getting an erection. Okay.
I need you to be clear. What is your question?
So
what exactly is going on here?
Why? Does
it change? I guess does it change over time, like your sexual desires, and makes it hard, or is it just automatically?
Well, I think it's multifactorial. So sometimes as men get older, your sexual desires change. So that's one thing. Sometimes it's it could be psychogenic. Sometimes if you're stressed at work, you're overwhelmed with life situations, mental health issues that can prevent you from getting an erection. So for instance, let's back up. So the erection, the erection comes from the brain. It starts there. And that's your parasympathetic nervous system. So it starts there. Okay. So anything that kind of affects your brain kind of can impede your erection. So psychogenic things. Stress, anxiety. If you're having anxiety around your sexual behavior in the bedroom, that can cause you to have, repeated actions. Like someone saying you're underperforming in the bedroom, so you go and have sex in the bedroom. It's like, oh, here I go again. I hope I make it. 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 I didn't make it. Yeah. And so it causes stress, so that causes anxiety. And so that prevents you from performing. So that, with your erection. If you have medical issues, if you have diabetes, that causes issues with your getting an erection. Mm-hmm. That's one of the main things with diabetes. Sometimes obesity can lead to erectile dysfunction because, there's a little certain things in the adipose tissues, your fat tissues, that convert your testosterone over to estrogen. So it kind of lowers your testosterone levels. So sometimes low testosterone levels can cause you to be have erectile dysfunction.
And you've had, and I know, I'm sure you've had people come in and they'll be like, "Is there a way I can increase my testosterone levels?"
Yeah. I mean,
without having to depend on like a
medication.
Right,
yeah. It depends on the age again, and you look and see why they have low testosterone levels. Is it something going on with the testes, or something's if nothing, it's the system's okay. Then you look outside the system. Okay, are you exercising? Exercising can build your testosterone levels up. Doing isometric exercises can build your testosterone levels up. Push-ups. Body weight activities can build your testosterone level up. Building muscle in your body can build that up.
I was going to say, on the flip side of, or is it coordinated? Like, what if somebody isn't lasting as long? Is there a pill for that? Or is that just
as long?
Well, because like they'll just say, like, not to be funny, because it's different levels, right?
What's the?
Well, I'm just like, it's like
she's talking about the minute men.
Yeah, like if men, you have men,
they come too soon.
In their minds, maybe. I don't know. I don't know.
I mean, that's why people last so long. Are you coming too soon, or are you not? Because there are pills for like if you're coming too soon. You can get like a SSRI, like Zoloft or something like that, to help you not pre-cum.
But is that? I guess like I'm curious, like that a mental thing too, because you said like the erectile dysfunction, it starts in the brain, so like you can get in your head, the stress.
That's psychogenic, yes.
So I'm just curious because
it's anxiety issues around it, And then if you say, "Oh my God," he's not lasting too long, so the next time it's in the man's it's in his mind now that he's not lasting long, so increased anxiety. So the next time he comes to the table.
You're supposed to be quiet. You just can't say nothing. You just can't say nothing.
Let it ride.
Just be like this.
That's horrible.
The age old. I was just really excited.
Oh yeah.
Right, the way she rolled.
A lot of foreplay.
Yeah.
A lot of things. I mean, but it's like it's no.
Because it's not really, I mean, some men do experience that, and then I thought it was like hand in hand. Like if they had issues like keeping it up, then maybe when they finally do, then they are probably
it's two separate issues.
Oh, okay.
Separate things, separate issues.
That may be a pill for everything. I don't know.
It's not a pill for it though. It's not a pill for. It's a pill for like early ejaculation.
So,
but not for lasted like you want someone who,
I don't know.
You want someone who have a long erection for a long time, hours on end. That you can ride it forever.
That's why I didn't want to have this episode.
People that last until ever.
Look, Rachel's like, I should have just stayed
out of it. A men's grown folks' business. I should have stayed out of grown folks' business.
I want him to erected for 10 hours so I can ride it to the house, come home.
No. I'm just saying, because like, what if we have I'm just I'm not saying that.
She started so weird.
I know. It's so embarrassing. But I'm just saying, like, some men have different issues, and this is probably why they feel like, oh, we don't know the scale of what's normal and what's not normal, I guess. Like,
and then
are y'all having conversations of like, oh yeah, high five? I don't know, like what guys talk about. I don't know. Like,
high five.
I don't know. But it's just like, men deal with so many different issues. So I was just curious if it was in.
And then I think some men come in and ask that issue. I mean, but I don't think they talk amongst themselves about it. I mean, they come to the doctor and say, you know what, I'm not performing in bed. And you say, well, what's going on?
Right.
I have no problems with having an erection, but sometimes I just don't last long enough. I don't last long enough to please my partner. And that's creating anxiety in the bedroom. And
I do feel, I've seen the commercials about the pills. They're readily available. Call 1-800, all those numbers. You can even go to the gas stations. They have them up in the front.
The Black Rhino.
Yeah. So like, what you would prescribe is like totally different, more safer, or
it's more safer. What you get in a gas station is like
I was just about to ask
more herbal type medications.
Like, okay.
Are those safe?
They're pretty. If you don't have, they're pretty safe. They're a milder version of what's on the market.
Okay.
So like Yohimbe, horny goat weed, things like that.
But you shouldn't be doing that every time you shouldn't.
There are some men's vitamins and supplements that provide you those type of things on a regular basis. So you got to read those bottles, and you see, like you said, Men's Health for it has like horny goat weed, Yohimbe. Some other vitamins in there to help for prostate and improvement and also help to erections and things like that. So
and even with the like the Viagra and Cialis, what I know there's that risk that you may have an erection that's longer than, what was it, 3 hours? And that's when they have to go and see the doctor.
Yeah, you go see the doctor. You could take some. Well, I shouldn't take that, but yeah, you can just go see the doctor.
Just go see the doctor. See the doctor.
No free online visit. You have to come and see the doctor.
But yeah, I think that a lot of times, like when Viagra first came out, men were kind of upset because they were not. It wasn't working, so they come in and ask for a higher dose. But we realized that people were taking it with alcohol, and alcohol lessens the effect of Viagra. So that's one of the things that people don't realize.
Trying to have too much fun. Alcohol.
Right. I love to drink a little wine and pop my Viagra.
Yeah, that's not gonna work.
But Cialis is a better drug than Viagra. But for that, because you can drink with Cialis, but you can't drink with Viagra. And also I think that with Cialis and Viagra, I think they help. But those are, if everything else, but if you're still having issues psychologically, if you're not really focused, maybe you don't like your partner. You just doing a routine. You're doing a routine. Again, it's mentally. You don't like your partner. You're just trying to get in and get out, make them happy, but you don't really like it. You may not get an erection, but you turn the porn on, and here's comes the erection.
Yeah.
So
we're being realistic today.
So I guess I have just to kind of tie it all in together. Do those pills lead to any like heart complications? Because I know that is.
Yeah. So if you have heart disease, if you're taking like a nitrites type medications, you can't take this medication because it'll cause cardiovascular issues for you. So it's a no. So your doctor often asks you if you have any heart disease, if you're, before they prescribe this medication, because certain medications interact with these medications can kill you. Basically.
I think it's important to get checked out before you even start. Don't go to the gas station. Don't
go to your friend and take his blue pills.
Yeah, you don't know what his strength, his dosage is.
Right. You may have high blood pressure. You take a medication for it. You have heart disease, and you say, well, your friend says, well, take this blue pill because I had the same issue you have. Well, now you have a complication because you took his blue pill and your heart kind of exploded.
Yeah, now you're just doing real bad.
Yeah, your heart exploded.
So I know we did.
But on all seriousness, it's it's a severe complication when you take Viagra and certain heart medication.
Is that common though? For you've had people come in like, oh, I took my friend's.
No, really.
He said, I've been here 12 years. Really?
Everyone takes their medications. Oh, here's the blue pill. I mean, you take Motrin. Right? Yeah. You take Motrin, you take Tylenol. So I'll take this pill. What is this?
I just want to bring back around too. We talked a little bit. We haven't really dived into it, but like the mental health side of things for men, because even like the erections can be a mental thing. Coming to the doctor can just be a mental blockage of like fear, being vulnerable. So why do you guys feel like what's a way that we can get men to talk more about their mental health?
I think that you have to, men don't like to be vulnerable. So you have to be willingness to be vulnerable and open yourself up. Again, men feel that showing you that side of them, it makes them more vulnerable. Mm-hmm. So you have to get around that issue. So men finding people that are like-minded or going to a male psychiatrist or a psychologist may help you get past that issue because you can relate to one another. Mm-hmm. So that's one way to get around that issue. We all suffer from anxiety, depression, but men don't go to the doctor, and it causes complications down the line if you don't really address those issues. And I think road rage and all these issues that people have is related to not addressing your mental health issues.
Do you think road rage is okay?
Yes, anxiety, stress, trying to get to work, trying to get someplace
every day.
Yeah.
Oh.
I'm quite sure it's a form of road rage. Get out the way.
Yeah, that's a good point.
Yeah.
What do you think, Sean?
I'm an avid road rager. Not get out the car and do all that extra, but I have had a.
Oh, that's not good. We need to address that. Yes. But what do you think about men not addressing their mental health? What do you think is the blockage?
Part of it is that vulnerability. Just you don't really go with your homeboys when y'all are sitting there and playing at the gym like, oh, I'm having mental health issues. Man, I'm depressed.
But you talk about things in a certain way, you don't say I'm depressed and my anxiety, but You say, I'm stressed.
I've been stressed out at work.
I'm worried about this or worried about that. I can't make these bills. I can't do this. I can't provide for my family. You talk about things around the issue, but it's just like it's causing health issues. You can't sleep at night. You fatigue. You can't unperforming in bed. Those are signs and symptoms. You can't focus at work.
Right.
Those are all signs of depression and anxiety, and you need to seek out.
We actually just started I can't think of the group name, but I know it's a once a year. It happens around the breast cancer one, but there's a men's group that comes out, I think, the week after the Sisters in Arms breast cancer walk, and they do a men's fitness fair out by U of H. And they do like a walk, and they have vendors, and they pretty much tackle all kinds of issues that men can face that they don't normally talk about.
That's nice.
That's nice.
And
nice.
I also feel like men in general, you mentioned having the conversations, even if you do tell your friend like, oh, I'm feeling stressed, like y'all, it's very hard for men to take things serious. Like y'all just like, oh, that's a problem. Like if I ever ask a man to give me details in a store, they're like, I don't know what happened. I don't know.
I think that's the part of like why people don't go to the doctor, because we downplay everything. We downplay our symptoms. We downplay, relationship issues. We downplay a lot of things. We don't face things as we should face them.
Yeah, I'm a big advocate for mental health. So if nothing else, at least go talk to that person. I'm gonna be like, go talk to that lady.
I think mental health is like it's like you telling your secrets to a friend. I mean, you tell your secrets to a friend already, but this is like you telling your secrets and your issues to someone that it doesn't go any further than that. Mm-hmm. So it's even better than having the best friend. It's like you're paying for someone to keep your secrets. So why not go to mental health issues and discuss it?
I like that. You might as well. You're paying them.
Right. They're keeping your secrets.
Hashtag,
they can't tell somebody.
Oh, I haven't did a hashtag in a while. Hashtag keeping your secrets.
Your secrets.
Don't say that, lady. Keep them secret. The secret keeper. I like that.
No, she's not gonna kill no one. Suicidally.
Oh yeah, there's some things they do have to tell. That's true. Okay. That's true.
But most times they keep your secrets. Yeah.
Well, I just think it's interesting how everything, regardless of your gender, mental health plays a big part in a lot of things that we, downplay or underestimate. So, if nothing else, I do think talking to somebody, and then maybe they can encourage you to go get those stress tests and
not wait till last minute.
Yeah, until your heart starts hurt, your chest is already hurting, and now
you're like, oh yeah.
Now you're getting the bad news. Now you sound like my dad. Like, dang, every time I go. Well, you waited 30 years.
Every time I step, I get dizzy. Yeah. That's the issue.
You might want to go see somebody. Yeah. Y'all so stubborn. I'm not saying stubborn.
And watch your dietary habits. Don't eat that 16-ounce steak. Cut down on the high fatty foods. Mm-hmm. Cut down on the the dietary a lot of dairy in your diet. Exercising. Cut back on smoking if you're a smoker. Vaping. We don't know what we're vaping.
Yeah. Don't say drinking, because I don't think.
And drinking, moderation is always key. Moderation in drinking is, not drinking. If you're drinking every day, it's a form of addiction. It's a form of you're self-medicating. Sometimes if you have to come and get a drink every single day, 200 drinks every single day, you're self-medicating. Well, you need to go to mental health.
Luckily today is not about me. Luckily today's episode is not about me. We'll go ahead and pass it over to Sean.
They said a glass of red wine a night is healthy.
Oh my goodness. Well, we'll go ahead and...
At night? Every night? That's like 7 glasses of wine a week.
No comment.
Okay. Well, we appreciate you for coming out today and your busy schedule to kind of talk to us about some issues with men's mental health and overall health. Is there anything that we didn't cover that you would like the listeners just to take home and note?
No, I think that, against that, one of the things that you should do going forward is like dietary habits, exercising, mental health issues. Those are the things that would keep you healthy and a healthy lifestyle, and going forward. Watching your smoking habits, your social things like that. That will keep you healthy. So.
And get tested.
And get tested.
And then there was one quick thing. I know a lot of guys prefer a male doctor when it comes to things like this, situations like this. Mm-hmm. Where do you, in St. Hope, can someone schedule an appointment with you? What locations do you work out of?
Bel Air Tuesdays and Thursdays and Mondays, and also Conroe on Wednesdays.
Nice.
Okay.
And occasionally Greenspoint, we can catch you out there.
Occasionally Greenspoint.
We can catch you out there every now and then. Nice.
So, thank you again, Dr. Sims, for your time. I know
Thank you for inviting me. You guys took forever to invite me.
I was just about to say it'll probably be 2 years before y'all ever see him again, because it was like pulling teeth. If you would like to schedule an appointment with Dr. Sims or any provider for our men for physicals, examinations, testing, feel free to use our website at offeringhope.org, or you can call us at 713-778-1300. And thank you all again for listening, watching, what have you. And just remember, here at St. Hope, you're more than just a number.